Hello, my name is Dr. Wagdy Girgis. I'm board certified in family practice and also certified in wound care and hyperbaric. I work here at Maimonides Medical Center, managing the hyperbaric and wound care center. I start my specialty because when I started working in a nursing home and I saw this number of patients, it was very, very depressing and very, I become kind of emotionally attached to this kind of problem because I saw the amount of suffering that they have. And I started to work in that area, in the wounds, get my certification and practice on it. The special area of interest is the patient with chronic wounds. Patient that has multiple decubitus, patient that diabetic has foot ulcer, end up with amputation. Before they end up in that road, they come to the wound center that we have here at Maimonides Center, which is a very comprehensive program, team approach to evaluate the problem. And we really save legs and stop patient suffering. The team effort and the team approach to evaluate the patient with chronic wound is multiple area, because what we see actually when the patient complain about open skin that's not healing for a good few weeks, it's not just a wound and it's not a local cream that you wouldn't gonna close. There is other factors and it's too many of them. The mainly one that you look at it, especially in elderly patient, is a patient don't move and always laying down in that area on and off, incontinence, stool and urine, contaminating the whole area. That area you work on it. Then you work also in the circulation part. You want to make sure that there's enough circulation going on, enough nutrition going on. So there's too many areas between physical therapy, nutritionist, vascular part, the nurse and the nurse aid area. Now it's a lot of education involved to reach to the goal. The current trend in the field is to be more aggressive. Surgical debridement for all these necrotic chronic wounds, converting that chronic wound to be acute kind of wound by frequent visit, weekly, bi-weekly, it depends, with again surgical debridement. And the big throw that we have recently, last few years, is the hyperbaric treatment. And hyperbaric, it's a pressure oxygen that the patient will inhale inside the chamber, closed chamber, and that will stimulate the healing process, the fighting against infection, the rejuvenation of a small circulation around the wound to make it close. I want my new patient to know about the center that we have, the Hyperbaric and Wound Center in Maimonides Medical. It's all about healing the chronic wound. That we do have a team approach to reach your problem, to know exactly what's the reason for it, and deal with that problem until we heal the wound. I think the moment that I always remember is the time when the patient healed. Because most of the patients that come, most of them actually, not few, most of the patients that come to the wound center are the patients that went to too many different places and they just not healed. And they come because they know about the wound center, from word of mouth more than anything. And I think the best moment is the appreciation after patient healed and you stop the suffering that he's been having for all this time. There is a special case with an elderly lady that went to many vascular surgeons, general surgeon, and the answer is amputation. And she has a very good caring donor actually. They hear about us, they came, and the foot looked very bad, gangrene, smell, so it's amputation is the answer, there's no question about it. But there is other way of doing that, which is a gradual debridement with other modalities like hyperbaric and to cure the infection. Since the patient was refusing any amputation, she's an elderly patient at 90, but she's awake and alert and a good 90 years old. We went through this case gradually, weeks and weeks. I'm not saying take few days or few weeks. It may take few months actually. But now there's no amputation. We did take off gradually a couple of the toes that was necrotic and dead because it's not gonna come back. And it was a very special moment actually.